what are you doing?
Nothing.
Nothing? Why not?
I'm trying to get on this Lifestyle Radio website.
Sounds like a cool website.
Yeah, it's alright. Oh, hey, I might have it.
You might have it.
You're listening to Lifestyle Radio.
Good evening. I'm Coulter Wonkite. I'm already into the 420, damn it.
You like music, you like weed, well, we gonna be good friends indeed. This is not much I like more than smoking trees. They'll make you dance the do-si-do and teach you how the chiba grows. Smoke a bowl on the 420 radio show. On Lifestyle Radio.
Voice.
This is the 420 radio show once again, and we are still here at the, what's it called again, folks?
We're at the Prince Edward Island Maritimers Unite for Medical Marijuana. This section is the Brain Health Matters show. And
please explain to me what we're going to be talking about and hearing and who and what, where, how, and when.
Absolutely, absolutely. This portion of the event is going to be talking about PTSD and using cannabis for mental health purposes. It's the Marijuana for Trauma folks. Some veterans there, 15 years of combined military service between them, and they're talking about what they're doing to help people with PTSD. And Tabitha's going to be there as a peer support worker and therapist, talking for mental health, talking to people about her experiences and how she's used cannabis and what it's done for her.
Awesome. And Marcel actually just smacked me in the back of the head and told me that Tabitha will be on the show with us at some point in the very near future. So.
Oh, very cool.
Yeah. Okay, so
That's an incredible story.
We're gonna sit back and we're gonna do some more listening. And thanks for listening. If you want to listen to us, you can hear us every Friday night at 7 p.m. Eastern Standard Time. And now we'll take you to Brain Health Matters on the 420 Radio Show.
Without further ado, I'd like to begin to introduce the afternoon session. We have John Percy to my immediate left, who is the former leader of the Nova Scotia Green Party, and as well he sits on the MUMM board in Nova Scotia. He's agreed to moderate the afternoon session, and I will let John introduce the panelists. I'd like to thank everybody who traveled here for the afternoon portion, and a big shout out to the crew who are here from Marijuana for Trauma to help make this afternoon session possible. And I'd like to also give a thanks to the Truro Herbal Company, for all of your input and your presentations and information that you shared with us this morning. So take it away, John.
Thank you, Debbie. We're starting to get used to doing these things. People are inviting us on a much more regular basis to have these education and information sessions that are really seem to be finally working, and we're very gratified at that. And we'd like to thank you all for turning up, and Kat and Roger for putting this whole thing together. And let's get to it. Brain Health Matters. A discussion really about cannabis and the medical use of it in treating depression and in treating post-traumatic stress disorder. How more? Okay. I could just talk louder.
That works too.
Yeah, okay. And it's generated some interesting discussions in the past. We have a couple of returning panelists, and we have some new panelists here. To my immediate left is Maria Hagen, and she is a pharmacist, and she has also been a medical cannabis patient, and she has some interesting insights into that particular facet of how we would deal with medical cannabis in a pharmacological way. And there are questions and that need to be asked in a broad spectrum that include pharmacists, and they include other panelists like Tabitha Ward, who is a peer support worker in the Nova Scotia Community Mental Health System, and again a medical cannabis user, and it actually allows her to continue her work. And she has another unique perspective of someone who is not only holding down a job and continuing on with their lives as a medical cannabis patient, but also dealing with people who also have similar issues that she may, be able to help as well. And next to Tabitha, we have a group of people led by Fabian Henry. These are people from Marijuana for Trauma in Oromonto, New Brunswick, soon to open in Sydney. Is that correct? We're open in Sydney. You're open in Sydney. That's great. Marijuana for Trauma has been exploring alternative therapies, specifically for veterans, but I believe you're also open to public input. And they're looking at alternative therapies, one of which is medical cannabis. It may or may not be perfectly right for what it is that you're experiencing, but it's there as a viable option among a list of other options. And they're going to speak from their own unique perspective as well. And I kind of mentally drew straws by looking at people, and I decided who was going to speak first. And that's going to be our pharmacist, Maria Hagen.
One thing that I will correct is I am not a medical cannabis patient. However, I have practiced for 30 years. I graduated in 1985. I think it was during my university career that I started smoking pot. I am a professional. You come into the pharmacy, you would never know. I built some of my evidence-based medicine that my peers, my younger peers, keep shoving in my face, saying there isn't any. I can tell you by looking around and talking to you people, there's lots of evidence-based medicine for using cannabis. I can tell you from personal experience, I would smoke at nighttime. I would smoke if I knew I wasn't on call. I use it for anxiety, for stress. It works well. When Debbie first asked me to speak, she said brain health, I'm thinking, okay, that's a big, broad topic. I said specifically. She said, okay, post-traumatic stress disorder and the medications that go with that. So I sat down and basically looked and said, well, I'll do the medication side effect profiles of your most common classes of medications, pharmacological medications that are going to be used for PTSD. So, post-traumatic stress disorder is defined, and those drugs are wild and wonderful. It is defined as a pathological anxiety that usually occurs after an individual experiences or witnesses severe trauma that constitutes a real threat to their physical integrity or life of that individual or someone else. I'm looking around and I'm seeing how many professions have PTSD attached to them. There's a lot. You don't have to be a veteran. You don't have to be a firefighter. It's just something that can come from your perception of what your threat is. So I think we're going to start to find a wider and wider audience for who's developing PTSD. When you're thinking of PTSD, your signs and symptoms are usually persistent re-experiencing of the traumatic event. Flashbacks. Resultant numbness or hyperarousal. So you could be either way. You could be, I just can't function. Or I can't sit still because if I do, I start to think. Avoidance. Negative thoughts, moods, or feelings. The other thing about getting a diagnosis of PTSD is that your symptoms must be present for a minimum of 1 month. So it's not just a minor stress incident, resulting in the loss of a loved one or something of that particular sort that causes you to go a little bat crazy. They have to be there for a lot longer. In addition, most times we find that the patient's general appearance may be affected by it. They appear disheveled, poor personal hygiene. Chronic PTSD may come with also your sleep complaints, your general medical conditions that you just really can't put your finger on as to why they're all happening. In this particular case with PTSD people, the first management is look at their sleep hygiene. If you do not sleep, you do not get well. So your management for PTSD includes the prevention by initiating assessment and treatment quickly after the event, even well before a diagnosis of PTSD is made. There's a combination of pharmacological or drug and non-pharmacological, non-drug therapies. Primary psychotherapy. So your non-drug therapies include things like group therapy, individual and family therapy, cognitive behavior therapy, which is a psychotherapy based on the idea that our thoughts cause our feelings and behaviors. The one thing that I did hear the other day on CBC was that somebody has, the Americans have a program that they're using with our veterans. The Americans are using with their veterans right now. It's game playing. It's bang, bang, shoot 'em up, and be realistic. So they're using desensitization as part of the cognitive behavioral therapy. Just new. Our Canadian government has just purchased part of that. And it will be Canadianized into Canadian uniforms, Canadian places that we've been, so that we can help some of our veterans. Play therapy, art therapy, anxiety management, eye movement desensitization and reprocessing, I imagine. Hypnosis and relaxation techniques. Now, we also know that using medications alone doesn't help as much as putting some of the non-pharmacologic and the pharmacologic ones together. PTSD is such a multifaceted disease. I don't think any one avenue will work 100%, maybe not even 70%, and that's why you have to be multifaceted. What I basically was looking at as a pharmacist was medications. I mean, they're going to be used for all of those symptoms. We've got many, many classes of drugs that we're using, some to treat more of the re-experiencing of the traumatic effect, some for more numbness and avoidance. It does enable, your medications do enable your patients to be able to work together with others and be more profitable for their company, to be there with their families instead of just being somebody that's in the corner that can't deal with anything. What you have to remember, whatever you choose, medications in particular, all have side effects. Doesn't matter what you use. Natural does not mean that you do not have side effects. everything has a toxic level. When we talk about side effects, we talk about serious side effects and common side effects. Your serious ones are generally life-threatening, most often are dose-related. You take too much, you're over the LD thing. Disease, age, weight, or gender-related. They can be issues like vascular, heart, stroke, blood disorders. They could cause physical debilitation, cancer. That's pretty serious. Big one, death. I have an old CPS at home. Sometime when I have nothing better to do, I should go through those medications one by one and maybe list which ones of them out of that 6,000 or 10,000 drugs actually list death as a serious side effect. It's a good portion. That's not to say that serious side effects don't happen. They do. We as pharmacists try to minimize that, but that doesn't mean that that we catch them. With the amount of people going to different pharmacies or getting the medication online and then visiting their community pharmacy for their over-the-counter medication, many things do happen. Now your common side effects are things like gastrointestinal issues, the nausea, the constipation, the diarrhea. Your mental alertness. How wide awake are we? Everybody up, let's do 20 jumping jacks. Do you have sleep issues? Are they causing pain? Did you end up with skin reactions? So that when I think of the common ones, those ones generally come up. I started on a medication 2 weeks ago and now I'm covered in rash. I think I got into something. I must have eaten something bad. If I was to try and list the serious side effects for all of the medications, almost the majority of the drugs that I would be showing you would be coming up with a list of anywhere between 10 to 20 side effects. So I chose to look at the common ones, which means that you're going to have more prevalence of seeing them anyway. So the principal agents that we tend to use in pharmacy for treating PTSD victims are things like antidepressants, benzodiazepines, controlled substance, beta blockers. When I think of beta blockers, I think of heart, monitoring your pulse rate. Something's wrong with your ticker. Anticonvulsants, atypical antipsychotics. So now we're getting into the schizophrenia meds. Alpha-1 and alpha-2 blockers, I generally think of those as blood pressure meds again. So, when you're thinking of your antidepressants, everybody's probably by now, we readily throw these in acronyms out. SSRIs and SNRIs. So your selective serotonin reuptake inhibitors, those are things like your sertraline, your Paxil, your fluoxetine. Your SNRIs are your venlafaxine, your Effexor, your Remeron, your Elavil, antidepressants, tricyclics. Most of those antidepressants are really, they're such a wide range of drugs. They're used for all of the symptoms. So you might be using them to control the avoidance. Somebody else might be using them to control the actual reoccurrence of the traumatic effect. Your benzodiazepines, Ativan and Valium. Good old Ativan. Probably benzodiazepines, that they're very, very addicting. And they're used for the anxiety component of your PTSD. Your beta blockers, generally we see Inderal or propranolol being used as it's been around for ages. It's got so many off-label uses, it's amazing. They'll use that for the hyperarousal because basically that is being used to bring down your heart rate. If I bring down your heart rate, I slow you down. Anticonvulsants, Tegretol, lamotrigine, they're for the impulsivity and the emotional. So you can see how they sort of an anticonvulsant that, they're working on brain chemistry, they're changing something to allow you to have those brain synapses fire off on the right firing and not be sporadic all over the place. Alpha-1 blockers, prazosin. Interesting to note that the antipsychotics, the alpha-1 and alpha-2 drugs, they're being used in PTSD, but they're not actually listed in the CPS as being able to be prescribed for that. So that's what we call an off-label use. Alpha-1 blockers, nightmares and sleep disturbances, and your hyperarousal and possibly nightmares for your alpha-2. Now here is where it gets really fun, because I don't even have the chart. You have to picture all of those drugs across the top of the chart. So there's about 15. And you start to add in all of the blocks of how many. And when you get finished, block it all off. So you've got drowsiness and irritability and sleep disturbances and sleepiness and too much being awake and I'm trying to think of the other. There's about 25 various complaints of what these drugs do. Blood dyscrasias, causing your blood to be grow not enough white blood cells, and it is just an incredible amount of side effects that you can think of: diarrhea, constipation, nausea, and then start blacking out where each one of those drugs has one of those side effects. And when you get finished, that chart is between 50 and 75% full of black spots for what side effects each and every one of those drugs have. Some of them have up to 15 side effects, common side effects. So I apologize for that PowerPoint not working and not having the chart for you to be able to see that, because it is very impressive when I tell you that cannabis, as compared to these other medications, has 7 side effects. The 7 side effects of cannabis: decreased short-term memory, dry mouth, impaired perception and motor skills, red eyes, sleepiness, mild euphoria, and relaxation. They may very well be common side effects, but when you're looking at the treatment of PTSD, there is...
Excuse me, Maria. People are asking, could you speak right into the microphone? They can't hear you.
Okay. When you start to look at the side effects of cannabis as needed in the treatment of PTSD, most of those common side effects of marijuana are actually things that you want. Maybe not the dry mouth. Maybe not the red eyes. But you're actually using what it does to help with your PTSD. There can be more serious side effects, and there are. Your panic attacks, your paranoia, your acute psychosis, and I'm sure that anybody that wants to have that conversation can probably take Chris afterwards, and he'll give them a very good discussion on psychosis. Most of those are only, a lot of times, they're only seen in new users, or someone who has eaten way too many brownies without realizing that the brownies were laced. They're not going to kill you. You will not die from marijuana ingestion. You're going to have a darn good sleep. Smoking your marijuana is going to be faster. You can titrate a whole lot easier. Why is it that doctors these days can't figure that out? My famous quote is, I don't know why it's taking so long to get this done, because all you have to do is look around to the people that were there in the 60s. Where are they? They're your professionals. They're your retirees. They're probably still smoking. Your eating is less predictable. It takes longer. The U.S. National Library of Medicine, I pulled this right off of their website. The long-term effects of marijuana they list as, and I'm not sure I agree 100% with them, but I figured I would give the other side of the professional. They say that there's reduced resistance to common illnesses, that there's a suppression of the immune system, that they've seen growth disorders. They see an increase of abnormally structured cells in the body. They've seen a reduction of male sex hormones. Rapid destruction of lung fibers and lesions. Reduced sexual capacity. Study difficulties. Apathy, drowsiness, lack of motivation. Personality and mood changes, and the inability to understand things clearly. I think there may very well be studies, I haven't looked for them, but I think there very well may be studies that will have gotten rid of a lot of those by now. I know that I don't believe that the suppression of the immune system should still be standard. Because it may just very well be the opposite. So, when I, as a pharmacist, come across someone who is using or asking about medical marijuana, I am very pro. I'll send you in the right direction because you will have less side effects than those supposedly pure pharmaceutical agents that I can legally dish to you over the counter. And I would rather see you smoking pot. Thank you.
What I found especially scary during Maria's presentation when she was listing off all of those drugs is that I thought, I've had all of those. I've been prescribed all of those. And now I don't use any of them. But I recognize every single one that she mentioned. I've had that. Yeah, I've had that. Yeah, oh yeah. Oh my gosh. Yeah, I don't use any of them at all anymore. I only use one thing.
Cannabis.
Strangely enough, it works. And, well, proof's in the pudding. Don't eat the pudding. Our next speaker is Fabian Henry from Marijuana for Trauma in Oromoco, New Brunswick, and he's brought most of his group with him. Did you want to use the podium? That'd be great. And we're going to get Fabian's perspective on this.
Good afternoon, everybody. Thanks for coming. I'm going to introduce the rest of my team first. We got a hyperbaric oxygen manager, Bob Rock. These are one of the other therapies we offer at MFT because cannabis isn't a cure; it's just a tool to manage symptoms. Corey Pike is the vice president and cannabis coach. When you come to us for cannabis, we don't just get you a prescription and send you on your way. You're assigned a cannabis coach who educates you, assists you through the process, the paperwork. You know, you're not just left in the dark. It's not a snatch and grab type thing. Clint Mainville is a peer support coordinator. Our group of people need some camaraderie type stuff again. So we run peer support meetings every 2 weeks just to get together, medicate, laugh, medicate, laugh, medicate, and laugh again. It's fun. Vince Rigby, he's the president of our Sydney chapter. He's trying to do the exact same thing we are in New Brunswick, except in Sydney. And I got guys in St. John's, Newfoundland doing that, and Markham, Ontario. So in 14 short months, we have 4 clinics out there. We've helped over 600 vets access cannabis therapy. We don't just help veterans. We help civilians, first responders. This medicine is beautiful. And to touch on the medications she talked about, we all understand that. I don't have a PowerPoint because I'm the living proof of what she was talking about, so are the other guys that are here. The benzos and clonazepam, effectual butyl, they contribute to suicidal ideation, without a doubt. Here's a little fact that since the Afghan conflict in 2002, we lost 158 soldiers to that war, and we've since lost 180 to suicide from the same conflict. So we've surpassed the death toll in Afghanistan. And the only thing that's working, and the reason why we're still here is because we found cannabis. I found it 5 years ago, and, you know, MFT was born 2 years ago, and I don't want to be quiet about it, hence the logo and the name. We're smashing the PTSD stigma and the cannabis stigma like nobody's business. And they don't really know what to do with us. I'm not a favorite on anybody's agenda at high levels, and I don't really care. I still know how to make them pay the bill. We help with paperwork. We help with allergy testing, all kinds of things. The cannabis is just treating our symptoms of PTSD specifically. That's not an answer, and it's not a cure. We also offer neurofeedback therapy, hyperbaric oxygen therapy, stuff like this, to treat the injury. On top of that, we're developing a holistic retreat in rural New Brunswick that's going to offer nature type things like sweat lodges, drum circles, kayaking, fishing, art therapy, music therapy, yoga, organic food. When you encompass all this out in a naturous environment, add cannabis and take away the SSRIs or whatever, you see a quality of life increase. You don't see a cure. And that's all we're about, is a quality of life. The other people I want to mention on my team are, I don't see Arlene, but Arlene Lively's here, and she's doing a thing called Comedy for Quality of Life. And we have 24 booked venues across Canada from BC to Newfoundland happening this summer. That's going to raise awareness for that retreat I'm talking about. Another company we have is called Veterans for Healing. That's non-for-profit, and it's raising funds to send veterans to this lodge, because the government won't pay for this. The biggest problem is at the top. We all know it's medicine, it's what we're here for, but it's not Harper, it's Rona Ambrose who's telling us that it's not medicine. The Minister of Health won't identify it as medicine, and you say there's clinical research, well, it would have a drug identification number. They don't want that to happen. So some change has to happen at the very top. They're not going to listen unless we group together in numbers. I do have a video I wanted to play that encompasses everything that I've done, tried to do so far with our group. Sandra, can you play that? Sandra is also in the Sydney chapter, and it's Vince's wife, and she helps us out a lot. And in the back is my assistant, Megan Bishop, who's here with my two kids, Myra and Cole. All right. So it's a 7-minute video. Really captures the essence of what we're doing.
We offer much more than that. We offer the brotherhood that we subconsciously want so badly that we've been used to, you know.
We offer much more than we offer the brotherhood that
depression, all that stuff. You know, I still do have it for the most part, but I'm never in control of it now. I know when I wake up in the morning that I'll go to bed just as happy as I woke up in the morning. I don't got to worry about spiraling out of control with something that I didn't see coming, you know. And that's just little things like somebody looking at you the wrong way. You can think, that guy's out to get me, or, you know, just little things like that spike your hypervigilance. And now I don't gotta deal with that. I just put it away.
The best way to relate mindfulness to those that are in key forces awaiting release or transitioning is that it's your situational awareness. When you're in theater, you better have situational awareness. That's why they come back, or we come back with hypervigilance. Mindfulness is being aware of your surroundings. Are they looking inward and understanding what's going on and being present? Learning how to do that takes time. It's very difficult, actually, to take time off for yourself and be present. Thank yourself for one day. That's tough to do. So when you take an ego-driven military guy who's trained one way and try to make him mindful, it's very difficult. It takes a lot of practice. Cannabis helps with that practice. There's no prescription drug that I've taken. I'm sure Chris has taken that's helped us be mindful. Like Andrew said, it turns us into zombies. It causes erectile dysfunction, that you can't get up the couch. Can't have sex with your spouse. What kind of life is that? They wonder what a divorce rate's on.
If we are going to be an evidence-based community, then we should certainly look at the evidence for medicinal marijuana. And we should use marijuana where the evidence says that we should. And we should not use marijuana where the evidence says that we shouldn't. The current data does not suggest that pharmacotherapy is effective for treating veterans for PTSD. But we do have good quality evidence that a lot of veterans do very well with cannabis use. So a client, Andrew, came into marijuana for trauma a few months back with shaking so bad he couldn't hold a cup of coffee. I arranged for Andrew to try cannabis called Abigail, which is a CBD dominant strain that does not get you high. I could not use CBD and get relief. Andrew, however, inhaled vaporized 1 gram of cannabidiol, and in 3 minutes went from violently shaking to completely stopped and able to have a complete conversation. When I seen that with my own eyes, so many things were going on in my head that people need to see this. People can't think that cannabis has no value, no medicine, no place in the medical world. It does. Even if it's only for Andrew, and he uses a different cannabinoid, and he doesn't get high. Soldiers aren't out there just getting high. We're feeling normal.
approach, and the recommendation is to vaporize the marijuana, and oftentimes patients use something like this. It's about $300, and Veterans Affairs Canada covers $300 every 3 years.
What time are we at? We're at 3 minutes and 22 seconds. 3 minutes and 22 seconds after using 3 vapor bags from the volcano and approximately 1.5 grams. Air shaking has stopped almost completely. It's only ignorance amongst healthcare professionals to deny somebody access to such medication.
This is a band-aid solution to a gaping wound.
As I said before, there is no cure for PTSD. So, yes, it's a band-aid. It's the best band-aid to control our symptoms. You still need treatment for your injury. You need neurofeedback. You need psychotherapy. You need family support. You need peer support. Then you need to come to a retreat, or you need to learn how to connect with nature and love yourself and love people around you. So, is it a band-aid? Yes, it's a band-aid. I didn't need this medication before I joined the military and for 7 years. But I need it now. And when I don't, I'll give it back. I'll stop doing it. And we'll all need it. Please contact info@mftgroup.ca and our team will help you. You will find relief if you have PTSD and you're suffering right now. This isn't just medication. We want you to be part of our family. Right? Be part of a trusted group again that really has your best interests at heart. Cannabis just happens to be one part of what we do.
It doesn't work out here. You don't have to be alpha. Again, in the military, it's all about being the best. You know, from what?
That's just a little video I had done recently from up in Ontario and our guys up there. We don't just help veterans. I just want you to understand that we're a special group that deserves this medicine. I'm going to say before anybody, because there's 15 deployments between the 5 of us for our country, and we've tried what they said would work, those pills that you talked about, and they don't. And this does, and we have that right, and so do you, and that's why I'm here, because it's not just about us. Trauma's trauma, stress and anxiety, we all have some of that. And this medicine is as safe as any to try and regulate your symptoms. If you do want to access a prescription, our team will help you. And a simple message to info@MFT Group, and we'll hook you up with the process, and we won't leave you hanging. I don't know how much time we got, but
how much more time did you need?
Like a few minutes. I'd like Bob Rock, just because it's a brain health matter issue. I'm sorry.
How are you funded?
We're funded by donation, by loan. So if you want to donate, I know these guys are trying to get donations, but so are we. And I've convinced people to give back to our group. We're trying to raise more money for the holistic healing instead of cannabis. It's just one part, and we'll find it. I found it before I was legal. I'll find it wherever I have to. But
where's the head office?
The head office is in Ormocto, New Brunswick, and we have a beautiful doctor there, Dr. Paul Smith, who works with us, and we'll see any veteran. We also have 3 other doctors in our network to help anybody, civilians around. Yeah, So we can help you if you need a prescription. Your doctor doesn't agree, that's okay. You have a right as a patient to a second opinion. So it's just up to you if you want to stand up for that. It's info@mftgroup.ca. There's pamphlets and stickers and lanyards and papers over on our table. Feel free to take them. They're free. I wanted Bob Rock just to talk a few minutes on hyperbaric oxygen therapy. As part of our membership program, if you do become a patient of ours, is we offer this therapy for traumatic brain injuries. It helps recover injuries faster, stuff like that. So I'll let Bob talk for a few minutes and then I'll be back.
Hello everyone, as Fabian said, my name is Bob. I don't know, can everyone hear me in the back there? I'll try to, I'm pretty short, I can stand quite close to the mic. As Fabian said, it's another tool that we use to help with our clients or our soldiers, our members of MFT that do suffer from post-traumatic stress disorder. And what hyperbaric oxygen therapy actually is, it's a chamber that we have. It's a personal chamber. It sits about 5 feet high, probably about 8 feet around, about 3 feet at the top. So it's kind of like one of those Apollo capsules. You're sitting in it. It's quite comfortable. You're sitting in a normal chair. It's pressurized to 1.3 atmospheres. So if anybody here is a scuba diver, that feels about 45 feet of pressure underwater. You're breathing 100% concentrated oxygen. So the oxygen that we actually breathe in this air here is probably about 22%. So 7 billion of us on this planet are walking around depleted of oxygen, believe it or not. So in this chamber, you're actually breathing 100% concentrated oxygen at a pressure of 1.3 atmospheres. And what it does is it actually opens up the capillaries inside of you and delivers, the blood plasma delivers this saturation of oxygen to the brain, and it actually regrows dormant or damaged brain cells, as well as damaged tissues throughout the body. For instance, anybody who has just recently had surgery or anything like that, those scar tissues heal a lot quicker due to the oxygen saturation in the body. And that's about it. Thank you very much.
We're going to move on now to Tabitha Ward. Tabitha is a peer support worker with the Nova Scotia Community Mental Health. Another interesting perspective here in how we can make use of this absolutely marvelous thing that we have been given. And Tabitha, over to you.
I lose my cool. Why? I really don't know why. I can't even remember. No wonder he went for a drive, not knowing why he's being yelled at. That is my PTSD. And what my family deals with daily. I'm not sure how to explain what my outbursts are like, or what's going on in my head. Then again, PTSD doesn't come with the instructions either. After the dust settles and the damage is done, it's not until then you realize you forgot. And whoever you took it out on is still wondering what just happened. I'm back in my office, crying, trying to wonder how I'm going to apologize. That's my PTSD. I'm a mother of 3. I have PTSD, depression, mood and anxiety disorder, and Crohn's disease. I started using medical cannabis in the middle of 2011. I've since lost 180 pounds, and I've cut off almost all of my other medication. I was sexually abused by my grandfather, uncle, and ex-brother-in-law. I had an abortion when I was 18, got hooked on pills, put a child in foster care because I was too sick to care for him. Failed at 2 marriages. My dad was an alcoholic, was never home. My mom worked every day to raise us. My grandfather used to tell me I would never amount to anything. And for years I believed him. In the middle of 2011, I was at my sickest and heaviest, weighing about 370 pounds. I was just told I had type 2 diabetes, was using a walker most of the time. My husband and kids had just become caregivers, something they didn't ask for. I had to do something or I was going to die. If I had to go to emergency to see a doctor, I carried a paper that read, patient has PTSD, depression, mood and anxiety disorder, Crohn's disease, arthritis, type 2 diabetes, high blood pressure, migraines, asthma, sleep apnea. On the back read medications, morphine, Cazimac, Humira, Doxepin, Naproxen, Typine, Clonazepam, insulin, and a few more. I'd use cannabis whenever I could. It's because I knew I was going to get a good night's sleep. The only thing that stopped flashbacks and the nightmares. It felt right. I felt something, not like a zombie. I received my permit to use cannabis to treat my Crohn's disease, but I knew it was going to help with so much more. Although I had my permit, didn't mean I was going to be able to just use and stop taking a huge amount of pills. It's not like that. Having my permit didn't mean that I could just, or I had it to use. I had been volunteering at a place called the Evangeline Club. They are a social and recreational drop-in center for people with mental health issues. Through them, I became trained in mental health first aid, assist. I now run a small peer support group under CMHA. Just because I'm trained in assist does not mean suicide doesn't cross my mind. Doesn't cross it on a daily basis. But it's still there. It always will be. After so many years of being told that you will never amount to anything, you start to believe it. When you're at your very lowest, there's nothing much going on in your head. It's like a windstorm. No one knows what to do. I left my house one day. I was headed for blood work. Then later that day, I didn't plan on going home. I walked into the hospital to have my blood work done, and I ran into an old client. He came over and gave me a hug. Said, drop in and say hi. We miss you. I thought, well, maybe I could drop in and say hi, and I would continue on with my plan later that day. After an anxiety attack, I chose to go. I opened the door, and she looked up at me. I completely lost it. She took me in her arms, told me I was going to be okay. She told me I was not alone. She's now my best friend. Something needed to change. I needed control of my life. Put it on the right track. Do what's right for me. I have control of my flashbacks and nightmares. I have control of my pain. Yes, I struggle every day with getting out of bed, but I feel now. I feel like I have a purpose for being here. Will my kids ever forgive me? I don't know. Will they ever be proud of me? I don't know that either. I hope that someday they can say, hey, that's my mom. Making changes is what it's all about. I didn't just start smoking pot and 180 pounds fell off. It took work, hard work, many days of wanting to give up. I started setting smaller goals for myself to achieve a goal. It felt great. I'm doing things now that I never thought possible. I've gone off of almost all my medications. I show no signs of diabetes in my system at all. I would not be here if it wasn't for cannabis. My anxiety gets high without it. My mood swings can be touchy. There are more good days than there are bad. Medical cannabis has saved my life. It's changed it for the better.
You're listening to Lifestyle Radio.
Where are we at now, John? The cannabis was great.
On the same note, I have a friend and she's affected by her blood pressure going down, and which then creates anxiety within her. Is that normal? Blood pressure go lower?
Your blood pressure lowers it's a very small amount that happens. Right? Not even that noticeable. And what we've done is we've worn those wonderful Holter monitors and things and studied this over 24-hour periods of time of basically tracking effects both ingesting and smoking. And the decrease in blood pressure is not that noticeable. What's noticeable is the increase in the heart rate. And again, it's only 10 to 15 beats per minute. But it's enough that if somebody was sitting there feeling the effects of a large amount of cannabis, they might think they're having a heart attack because they don't know what a heart attack feels like. Right?
Actually, in my case, I have taken it because I felt my blood pressure was high, and I've seen 20 to 25 points down just by having a joint.
That's awesome.
Yeah.
Especially if it's too high. But what I found, and even Rick Simpson, who started the whole campaign with using cannabis oil extracts, he said that cannabis oil or a constant use of cannabis, your body starts to metabolize everything better and utilize everything better to try and put you on a level path. And I have to agree, after this many years, that's exactly what's happened. My blood pressure now is 119/70 every time. I don't watch my diet. I eat whatever I want. I have the worst eating habits in the world. I only eat normally once a day. But my blood work and everything else comes back saying that I'm perfectly healthy and fine. So it's just a matter of maybe my body's gotten to that point where I'm on that level playing field and I'll stay there.
Another quick question, if I may. Do you find that it's quite common to be very hungry and have the munchies? Like, I'm fairly new at this, just the past year or so, and I weigh 160.
Well, I was hitting close to 300 pounds. And I went on the MS diet. That's basically you go 3 months with no food. Not a diet I suggest anybody take, but I ended up losing a lot of weight. My weight's now just starting to come back up. Side effects happen with everything, and one of the side effects of cannabis is hunger. But with regular use, all side effects go away because your body gets used to it, as long as you don't feed it. So normally what I tell people that are starting out is if it makes you hungry, go have some carrots, celery, something healthy, maybe a piece of fruit, right? Don't go for what you're craving, which is basically more of whatever cannabis you just ate, or sugar or bad foods, right? So when I say go eat a bag of chips, I'd rather you eat a bowl of carrots because it'd probably be a healthier option for you. After a while of regular use, you get to the point where you don't need that bag of chips or want anything afterwards. So your munchies feeling goes away. And we've had a few people
within our organization around us who've actually lost a lot of weight just from using cannabis alone. So it's just a matter of thinking about your own eating habits more than anything. But you got to remember, a lot of that stuff you're eating is also affecting your mental health. So you got to take all that into account as well.
I had a doctor deny me the surgery because of smoking cannabis. He told me that it would stop.
He told me that it would slow my healing process down, and that if he were to operate on me, I wouldn't heal as properly, and it would hurt him, because people would be going around saying that, you know, he operated on me and I was doing cannabis and I wrecked his work. That's what he told me, and I was kicked out of the Queen Hospital. He tore up the letter for me being able to get my surgery done. He made me leave with a broken cast. He just totally destroyed me and told me that I couldn't get an operation because I used marijuana. Because my doctor told me I could. What do I do now?
Get a new doctor. In all honesty, that's what I said this morning when I said I'd fired doctors for incompetence. That's the kinds of doctors that I've fired. Is somebody too lazy to do their own homework, investigate it, and learn it. Because everything he said was basically a lie. Cannabis actually works very well in the healing process, especially after surgeries and things like that. People lie. What else can you say? I mean, seriously, that's exactly what's happened in this situation. And it's a doctor that I'd report to the College of Physicians and Surgeons and say that he's incompetent and he's blatantly lying to patients and put out the factual points of what he's been doing. And denying you health care.
Putting your life at risk.
Yeah, exactly what it's doing. Yes, ma'am.
And always go with an advocate when you see these guys so that you have backup as to what happens.
Yeah, it's always good to, if you're going to a doctor, especially to discuss medicinal cannabis for the first time, have somebody with you. Right? Take somebody that knows, or somebody that, don't take me. You don't take me.
Marcel, when people contact PEI-MUMM, we do go to doctor's appointments with them. It doesn't do much good, I have to say that.
Well, maybe then you should take me. Because I have no problem looking at a doctor in the eyes and telling he's a liar. Doctors leave medical school, and when they're told to leave medical school, when they leave medical school, they're told they have to further their own education. That would mean learning about the endocannabinoid system and medicinal cannabis and things like that. Unfortunately, doctors are human, and humans can be a very lazy species. They rely on their educational material coming from pharmaceutical sales representatives. I used to be a salesman. I could have sold pharmaceuticals if I wanted to, but I sold other things instead. A pharmaceutical rep is basically that, a salesperson. And when the contract dies out for that flavor of the drug that week, they'll move on to selling a different flavor to the doctors. They don't educate the doctors. They say things like, oh, well, we've had other doctors using this same thing for this. And this is where off-label usage happens, and this is where it gets extremely dangerous to people's health, where you have people being prescribed 27 pills a day, and 5 of them are for the side effects created by those other 27 pills. Right? You have to educate the doctor and basically take in the clinical studies that they say don't exist with you when you meet the doctor. Whatever your condition is, and trust me, you can go on the internet and find clinical studies for your condition. And they'll have the information of how it's, as well as anecdotal evidence. All you have to do is always keep in mind, and maybe even reinforce the point of the doctor, is why was it in medicine in 1920 but it isn't now? Right? Because the doctors should be able to answer that question, shouldn't they? Because it was perfectly safe until then. Only because somebody said it was bad. It would be like me coming out and saying that, well, you shouldn't drink water because you can die from it. It's true. You need water to survive. Well, guess what? We're finding out you need cannabis to survive too. So just because it's a lie doesn't mean it's true. Right?
Absolutely.
Any other questions?
Say a person has chronic pain or, where do you go for it?
Where do you go for what?
How do you find out where to get cannabis or candy or...
You contact a group like Maritime Regenerative Medical Marijuana, Medicinal Cannabis Patients Alliance of Canada, MFT Group. There's a lot of different organizations that can direct you. Health Canada doesn't want this to be used as a medicine because of the impact it has to the pharmaceutical industry. I save the Nova Scotia taxpayers over $150,000 a year because I use cannabis instead of drugs and basically forced doctor and hospital visits to make sure I'm being monitored for those drugs. The new program now, as soon as you get your prescription form, you would send it to a licensed producer like Evan and his group, and then they would turn around and mail it to you. Or find some compassionate person on the street that's willing to sell it to you for your medical needs. Because now with the new ruling, that can happen. So, cannabis... Well, I don't recommend buying off the street, but before we had a medical marijuana program, guess where we used to get it? Off the street. Right? If you know what you're looking for and you can recognize molds and things like that, you're fairly safe. Because, again, over 5,000 years of documented history and not a single person has died from using cannabis. There's nothing on the planet that you can say that about. You can overdose on water and die. You can overdose on chocolate and die. You can overdose on caffeine and die. You can overdose on 10 Tylenol and die. But you can't overdose on cannabis because by the time you got enough in you to even come close to overdosing, you'd be sound asleep anyways. So you're not going to get any more into it. And so there's no fears with cannabis other than getting past that propaganda stigma that it's bad for you. That's all it is.
Comment when you're saying about doctors and pharmaceutical reps. One of the biggest reasons I find, and probably in Canada and the United States, I didn't believe in an organization that gives doctors and their families trips to Cuba and Barbados and everywhere else and pays for all this stuff. If they prescribe Viagra, if they prescribe Prozac, if they prescribe Sackville or whatever the hell they want to be prescribing that day. As medical marijuana, they don't want to prescribe that. They want to go to Cuba.
Well, exactly, and they're not going to make it. And this is the biggest problem with pharmaceutical companies. There's no money in cannabis for pharmaceutical companies unless they can develop it into a proprietary drug.
The practice of giving doctors and paying doctors and supplying pharmacies with excess medications or trips or goodies or whatever, definitely in Nova Scotia has been canned for the last 4 to 5 years. We really don't get anything. Whereas before, comics and goodies and pens and boxes of script pads and stuff at Christmas time. And yes, the trips for the dogs and stuff like that. Now, if you want to talk about them sponsoring an education session on a boat, yes, those will happen, but you're not going to see them pay for the flights. So
yeah, they cut out the kickbacks as much as they can, but a a lot of the specialists get paid honorariums for speaking at events and putting on luncheons for other doctors, so they can tell them about the great successes they've had with XYZ. Right? I come from industry. I did sales. I know what kickbacks are about, and I know how people get around kickbacks. The doctors aren't going to be any different. The pharmaceutical industry isn't going to be any different. Talking about mental health this afternoon, the mental health pharmaceutical market is worth $88 billion this year globally. Cannabis is worth nothing to them. All it means is it's going to cut into that $88 billion. So the pharmaceutical industry is fighting tooth and nail to keep our government from allowing you to have access to a safe and effective medicine. Is all it is. It's a sucky world, but we come out and we teach these publicly so that people are informed that they know that their doctors are getting. It's easy to tell which ones are getting the kickbacks, because they're the ones that are saying no, and they're the ones that keep trying to shove down the flavor of the day, whether it's an antidepressant or some new wonderful narcotic or even some great statin. Right? You'll recognize them. They're there. If there's no other questions, what are we doing for time?
We're doing just fine for time, actually. And the number one drug of abuse in the world at the moment is opioids and opiates. And the number one country for opioid and opioid dependency is Canada. And the number one province for opioid abuse is Nova Scotia. Overprescribing of legal drugs with EIN numbers, and the refusal to prescribe a plant is one of the enduring paradoxes of our time, I think. And I would really like to thank the panel today for some very interesting perspectives. I urge all of you, when we break, if you want to continue conversations with the panelists or ask for further questions, please do so. There are resources available. We can tell you how to access those resources, to make use of them, and to ask proper questions and where to get those answers. And please feel free to use us. Okay, thank you very much.
I'm going to steal some of those panel experts on, just for a little bit for Medical Review TV, because we got to get some interviews out there. So
fabulous.
We'll sneak them away and take into company.
Thank you all for coming.
This is the 420 Radio Show, and we're at the end of Brain Health Matters, and I just wanted to let Lori and Chris throw in their insight on what they thought about it, and say goodbye.
Well, thanks for having us on, Al. This it was a great conference. I think a lot of people left with a lot of good, useful information, and a couple of the comments that people shared were something, because there was health professionals in there too, so they got to chew on people talking about being refused by their doctors or having problems just gaining access. And the one lady that was talking about, her doctor said that marijuana doesn't let you heal. So people got to hear that doctors are misinformed, and they get to hear about a lot of the different ways that it can be helpful, regardless of what anybody else wants to say about it.
Well, real stories, I think, has a bigger impact than sitting there listening to Sanjay Gupta on CNN.
Yeah, actually, screw the study. I want to talk to somebody that's lived it.
Well, and that's one of the reasons why I enjoy doing the show with Lori and Marcel and having people like yourself on, because this for me is learning, Chris. This is how I learn, because I'm dyslexic. I can't read that well. So, books and shit. So my way of learning is to have conversations with Lori and Marcel and you and people like Rick Simpson and other people. And I'm hoping that helps other people as well. Lori, did you want to throw any final words in?
I'll just say that both the morning session on medical cannabis in Canada and the afternoon, when I was impressed as hell with both. Lot of really good information. I'm all about putting things in the right context, and I think that was a lot of what happened today. Particularly impressed with, I believe that was the pharmacist that was talking about how the cannabis does have side effects, but thankfully they're pretty much beneficial in application to the symptoms that we have. So even what you would consider with a chemical drug to be a bad thing is actually just another added benefit to ours. So, yeah, I was really impressed with the entire day, and I wish I had been able to be there, but oh well, maybe the next one.
Maybe.
Well, I'd love to have you next one.
You're going to be doing more of these, Chris?
Well, the Brain Health Matters, this was our second one. We had one in Halifax here at the Bedford Legion. We held one there, about a year ago. So this was our first time taking the spiel on the road and spreading the message with the Islanders and whoever else will listen to us at this point.
Yeah, I think that we need to start doing these things in Ontario and other provinces as well, because it's important. We were talking while this was going on, Chris and I were talking with Lori, and it's kind of disconcerting because in Ontario, being in the middle of the country, everything's kind of like money or patience, not knowing what to do or where to turn, right?
Right.
And I happen to be one of them, because even though I've been doing this show for 8 years now, I still don't know what to do as far as getting my meds done, and stuff like that. So
that's one of the things that I find most disappointing in the climate, if we call it that we're in today, with the legal situation and the denial of the facts that continues to permeate people's perception, I guess, of the medicine. And I'm so happy that you guys are doing these things down east, because we definitely need to see them across the country. I have to say, I think you guys have a benefit to those like Al and I, where we're in a province where we're so spread out. We don't have a close, the number of people in that area, you have more of a close community among the patients, I guess. I'd have to drive an hour and a half before I got to anybody I know on Facebook or sort of thing, right?
3 hours for me.
Well, I mean, but it took us 3 and 4 hours to get to the conference ourselves. So, I mean,
yeah,
right.
We are spread out, but in order for us to battle the lies that Health Canada's telling, some of us have to go out there and tell the truth.
Yeah, and we're going to be
right.
That's why you guys doing what you do and us doing what we do. Eventually, hopefully, we'll reach enough people.
Hopefully, because I'm willing to show up at anything that I'm asked to go to.
Oh yeah, for sure. Yeah, if we can umbrella this across the country from coast to coast, like that's what I mean. Like the situation on the West Coast is so drastically different than anywhere else in the country.
Well, I love my country. I love being Canadian, and that's where my heart is. But one of the things that I'm really trying to do with the 420 radio show and Lifestyle Radio is this is a global problem that we're having, and it is a problem. It's an epidemic. And,
it is, yes.
I'm hoping that what we're going through here in Canada and the presentations that we are able to go to and stuff like that will help. Even if we help just one person, that's really all that matters, right?
And we're helping more than that. I see it all the time. I get the calls. I mean, we're reaching so many more people than Rona Ambrose is with all the lies that she spit.
Well, and one of the things I'd like to highlight too is that although it may not have been obvious to anyone listening to either of the sessions, I believe there was a camera crew there from Medical Review TV in California. And it's actually Planet TV Studios Medical Review TV show that's going to be featuring the show is The New World of Medicinal Cannabis with William Shatner. And it's going to be a series of shows, programs. They're going to be coming back up here to Canada, I believe, a few more times maybe, to document the situation here. And we do have a unique situation that seems to have gone largely unknown, that we have people in Canada who have been legally treating themselves for, well, the one I know the longest had a Section 56 28 years ago.
Wow.
So we have a history of at least 28 years of people legally treating themselves with cannabis that it does not exist anywhere else in the world. And we've had to hone our own treatment plans, our own therapies, our own products based on our own needs. And I really think we have a unique vision that really needs to be shown. And that's why I'm so excited that these folks have contacted us and latched on to Marcel, and we'll be following him around.
It's I love listening to people talking about cannabis, anything about cannabis, really. So, I'm happy to be around for these things. Chris, my friend, would you please tell everybody where they can find out more information about MUMM and you guys there in PEI?
Absolutely. MUMM's got a website, mumm.ca, mumm.ca. There's our Facebook webpage, PEI, Maritimers Unite for Medical Marijuana, has their own webpage as well. I know that in PEI they're splitting up Charlottetown and Summerside and having alternate meetings so people can get from one end of the province to the other. There was somebody else there. He's opening up a chapter. He's hoping to get one going in New Brunswick. And there's somebody else that's opening up a chapter, hopefully soon in Cape Breton, her health permitting. So check us out on the website. Check us out on Facebook. Join on up. Become part of the solution and not part of the problem. Help spread the word.
Yeah, that's the big part right now, is helping to spread the word. Even if you're not a cannabis user, medical or otherwise. It's important information because the mainstream media is concentrating on one thing. Money.
The truth is the truth.
Money
exactly.
And getting high. That's what mainstream media is concentrating on. Okay?
That's why they call us pot users instead of medical cannabis patients.
Yep. Well, I mean, I'm
a medical cannabis patient. I'm a Crohn's patient that uses medical cannabis. So we got to get our political correctness back in order here.
And I'm a pothead that's from the 60s, growing up in Toronto, that now uses it because I've got diabetes and a bad back. And
call it whatever you want, just don't call it dope.
Exactly.
Yeah, exactly. Yeah.
So, but that's an argument that I have with Marcel all the time.
And me.
Oh, yes, and Lori, too.
Yes.
And sometimes
I'm a prude that way. I'm a canna prude. Okay?
Canna prude. But I call myself a medicinal. I'm a medicinal. I'm a medical.
Medicinal.
I'm a medical pothead. Okay.
There you go.
There you go. And on that note,
I'll never forget. Yeah. Never mind. Go ahead.
This has been the 420 Radio Show. We are live here every Friday, 7 p.m. Eastern Standard Time. You can catch myself, Marcel, usually Lori, Brian, Ellen, and whoever else shows up to talk about pot. There's that word.
Cannabis.
And we'll leave it at that, and we're going to say bye-bye now.
Bye now.
Peace.